Ooh. Hi, my name's Lindsay, and this is my presentation of future nursing certifications that I would like to receive. The first one is the Advanced Cardiovascular Life Support. This is different from BLS because it's not only teaching you about chest compressions, the air, how to use the respiratory bag and the AED, but it also teaches you signs and symptoms of cardio and respiratory arrest and how to treat them, and it teaches you the different medication that you'll use. Sorry, I can't say that today. It also allows nurses to treat cardiovascular emergencies, and I believe this would be super beneficial for my career because a lot of times where I work, you see nurses, they can only give basic life support rather than pushing medication for their patient. They have to wait for the rapid response team to do all that stuff. And it's kind of hard being a nurse of that patient and just not being able to do all that you can in that moment. You kind of just have to wait and do the basic life support and then wait for somebody else to come in and take over for you, which is great, but I would like to stay in to help my patient as much as I can. How to get your ACLS certification? There's a lot of options. You can find a classroom near you that teaches it. Sign up for a hands-on skills session. There is the ACLS EP classroom that you can sign up for, or you can also just do it online and buy the HeartCode ACLS course. The objective is, like I said, it teaches you basic life support, those chest compressions, the airbag and AED, but also it teaches you the early signs of respiratory and cardio arrest and how to manage it, the medications that they administer, and then also how to communicate effectively as a rapid response team member and also as a leader. You can get recertified by going to this website. It's the same as getting your certification. It just costs less. The next certification I would like is getting my emergency room nursing, because not only do you get to triage these patients, but you get to stabilize them, be part of traumas, and kind of be in that high level stress environment. I would love to do that because it's like you're always on the go, and I am the type to always want to be running around doing something. And also you get to see variety of patients, like different kinds of illnesses or traumas, like motor vehicle accidents. There's never ending of the diseases or traumas that you see in the ER. It's pretty fascinating. And also being able to work in that kind of environment, I feel like would be beneficial, because then that means that you can be kind of in any environment with that much stress. So to be able to get your certification, you have to have a valid RN license. Then you can have at least 2 years of emergency medical setting experience, and then you just have to take your exam. You can the process of getting this certified emergency nursing is right here at this website. You just sign up and you see if you're eligible. Then you just have to pay a fee just to see if your application will get approved, and then after that you just schedule a time and take your exam and pass it. And then afterwards, your license is good for 4 years. There's 2 options. You can either take that test again after 4 years, or you can have 100 hours of like clinical activities. It's kind of just a way to keep your education like ongoing rather than just not doing anything for 4 years and just working, you can like take classes and those will count as your recertification license. The next one I would like to get is the wound care nurse. These nurses, they treat all kinds of wounds, burns, ostomies, everything. They are amazing. I've been in like 3 rooms where they were doing wound care, and it was honestly amazing to watch. And it made me interested because I want to be able to give high quality care to every patient. And a lot of times these patients are coming from nursing homes, or they're just at home not getting up, they're just laying in bed and they get these nasty wounds. And sometimes you don't know how to treat it or the best way to. And I think working as a wound care nurse for a while is the best way to understand how to take care of those wounds. So to get certified, you have to have your BSN degree, a valid RN license, and then you need 120 hours of hands-on clinical training. Or you can do 2 years full-time of working in a setting where there is patients with wounds, or 4 years for part-time if you don't want to do full-time. To become the process to become a wound care nurse, you can enroll in wound care courses. After you take them, you just need to pass a certification board exam, and it goes through the WOCNCB. Your license is valid for 5 years, and then afterwards you just have to take that exam to recertify your license. The most effective and important to my career, I believe, is that ACLS. I think wound care is like right underneath it, but ACLS is like you can help your patients and recognize those signs of cardio arrest or respiratory arrest to where you can treat it as soon as possible and be on top of it, and even maybe recognizing them in early stages so it doesn't go so far as a code blue, and you can easily revert them back to normal sinus rhythm. The most beneficial in my professional goals is probably ACLS and the wound care, because I would love to give every patient that I have the best quality of care that they deserve. And I think continuing my education and learning how to handle these patients that you basically will come across a majority of your career is just the best thing that you can do. I have seen a lot of wounds that are pretty nasty from patients just not getting the care that they need, and I would love to be the nurse that can just avoid those kind of wounds or know how to treat it to make it better rather than worse. I came across these certifications by working as a CNA at a hospital. I have been a part of a code blue where I could only do chest compressions, and even as a CNA it killed me because that was my patient and I wanted to do more, and so that made me want to get my ACLS when I became a nurse. My long-term goal is to become an emergency room nurse. I love being on the go and on my feet as much as I can, and I love the diversity of patients in the emergency room, and I would love to know how to be able to treat the diversity of patients. And that's all. Thank you.